Welcome everyone to our Upper Midwest Telehealth Resource Center virtual office hours. Today we're going to be talking about webside manner instead of bedside manner. And I'll share a few slides. Feel free to interrupt me. You can unmute yourself to ask questions. You can put questions in the chat. We're a small group today and we're going to be pretty informal with this. We will be recording today's virtual office hours, and you will get an email within a couple of days that when that recording is archived on our website along with the slides from the presentation. So I'm going to go ahead and share my screen. Oh, can I have permission to share my screen, please? Thank you. All right, so my name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. And so these are the different topics we're going to talk about today as far as webside manner. So just some basics on video conferencing etiquette, lighting, background, and eye contact. So prior to COVID-19, normally a patient receiving a telehealth visit would be in some type of a clinical patient room, and the provider would be at a distance in a different location. So most clinical patient rooms are soothing. They have light colors on the walls. They're not too distracting. There may or may not be a comfortable chair to sit in, that type of thing. But the biggest, one of the biggest things in order to do telehealth is you have to have that broadband connection, that foundation for everything else. Now, if you're going to do something like diabetic education or group therapy, you might need more, the patients might need to be more in a educational setting where the presenter or the provider can be seen on a large screen using a projector, that type of setup. So however your telemedicine event is going to happen, your needs or the service provided during that telemedicine event is going to dictate your needs for the space and for everything around the patient. Typically, a patient just needs either like a smartphone or a tablet, a laptop or computer, but they really do need to have some type of a webcam enabled and good speakers and microphone setup. So now, during COVID, with the HIPAA waivers and all of the 1135 waivers for CMS, for Medicaid and Medicare and CHIP, most patients are at home during a telehealth visit or telemedicine visit. So here we see some different concerns that we've been addressing in our technical assistance calls and emails over the last, 4 or 5 months now. The first one is about privacy. Even if the patient is in their home, we want to make sure that they're in a private environment, that they're free to share. Certainly we don't want the patient to be down the road at a fast food restaurant where they went just to get Wi-Fi access or internet access. We do still have to deal with patient consent. States have updated those rules and they're different by state. And Medicare has its own rules about consent. You really do want to obtain consent. And even if you're seeing the patient for the first time and you have to get verbal consent in that two-way audio-visual connection with the patient, then you want to follow that up with an email or a snail mail or through a patient portal to make sure that that consent remains on file in the patient's electronic medical record. The other thing that we get asked about a lot is how often do we have to get consent? Is it on a per visit basis or what? And what we recommend is that you do it annually with your HIPAA paperwork so that you've got that on file and keep that as part of the electronic medical record for that patient. And then the last thing is vital signs. And we're not going to dig into technology hardly at all today, just to mention it here. But most patients at their homes, they're going to have thermometers to take their temperature. They're going to have scales to weigh themselves. They might have an activity band or an app on their smartphone that allows them to take their pulse or do other things, to take a picture and share a close-up image. And those are fine. You can do that. We do recommend that you document that those were patient captured vital signs. And there are different, you can search, there's just like buying a television, there's a ton of different vendors out there, manufacturers out there that make equipment to take vital signs. And more of them are starting to play in the home or commercial space. But that's really something that we'll address on a different call. If you have questions about that, shoot me an email. I'll give you my email at the end of today's session. All right, so let's talk about lighting, the junk in your trunk, and eye contact. So first, let's talk about lighting. So you want to have a diffused light source. You do not want to be backlit as your provider. And these are things you can talk about with your patients too. Prior to a telemedicine visit, the scheduler or medical assistant, someone in the office can send the patient information to make it an optimal visit for everyone. Here right now, I probably should have closed my blinds. Actually, I'm gonna go ahead and do that just so you guys can see the difference. But I've got a craft light so I'm facing a wall, and I have a hutch behind my monitor, and actually I have two monitors. And I've got a craft light on a gooseneck that's lit up to the ceiling, so it's turned up, and it's lighting the ceiling, so it's a diffused light and a daylight light coming down on me. But I still do have some shadow here. So let me adjust my blinds. And that's a little bit better, a little less shadow on this side of my face. So you don't want to be backlit. And behind me is actually a virtual background. We'll get to that in just a second. I see one chat. Oh, yes, absolutely. Thanks, Autumn. So you can also always email us at info@umtrc.org and reach out to us that way. All right, so you don't want this harsh directional lighting. There is so much light behind this woman, it is very difficult to actually look at her. All right. Now, this is the same person. She's sitting at the same desk, but we're seeing her, the camera's seeing her from a different angle. So the light behind her is not near as harsh, and it's a lot easier to focus on her and what she's saying. This gentleman here has got a light from the window coming in. Now, if his background and everything else is very professional, but it would be better if he would close his blinds because it wouldn't have so much harsh lighting on him. And now we're going to talk about backgrounds. So I mentioned I do have a virtual background going today, and I just felt like it. With Zoom, I primarily use Zoom, and it is a HIPAA compliant platform, but right now I've got my virtual background on. This is my normal background, and I felt like using the virtual background today. I didn't feel like cleaning up my space on my desk behind me. So I'm gonna put that back. And I've got all kinds of funny things. You know, you can find images for virtual backgrounds in a variety of different places. You know, you can make yourself look like you're everywhere. But of course, if you're a provider, you want to look professional. You want to have a professional background. So these here on my slides, if this was my doctor, I'm not sure that I would trust him because his room is kind of like a bad college dorm, not very professional, and a lot of clutter. This one down here in the lower left, again, lots and lots of clutter. If the provider had that light behind them from the window, I think it would be very distracting. And here's some examples of wall color. These are beige colors. They're not too bad. If you put this wall with all of the stumps behind you, I don't think it would be too distracting. But all this coffee stuff and that in the beverage machine, that's kind of distracting. You also don't want plants growing out of your head. So the studies show that the ideal wall colors a white or a light color on a wall can darken a face, and a dark wall can lighten a face. So the ideal colors for walls are light blues and light grays. They work well with all skin tones. So here again, I want to stress that between, and these two providers, they look professional. You can see they're in a professional setting. What you really want between yourself and your webcam is a clean and uncluttered look. So next, we're going to talk about the camera positioning. So like I said, I've got two monitors here in my setup. My webcam, so when I share my screen, I've got little thumbnails of all of us. And my webcam is right on top of those thumbnails. So I make an effort to look directly into the webcam, which is not natural, but it looks like I'm making eye contact with you, and it does make a difference. So it's like you're looking into a camera for your photo to be taken. Distractions. So you, as a provider, you don't want distractions. And as a patient, you don't want distractions. I'm sorry, my computer is lagging today. I think I'm having issues with the internet. So here today, I'm in my home office. I have closed the door to my office. I have locked the door. Everybody that's out here at the house knows not to bug me right now. I've got my phones muted, my devices muted, all of those things. So that we can have our setting here and not be distracted. It might be a little bit harder for the patient to not have distractions, especially if they're home, they have children. But you want to do whatever you can and advise them prior to the visit, whatever they can to minimize distractions. Taking notes. So if I were to start taking notes here, if I'm a clinician, and I'm looking up and talking to you, okay, and then I come down here, and so you can't see my face, you can't see my eyes, you can't even see my mouth. If I continue to talk, it's going to be garbled because I'm not looking directly at my webcam and the microphone that's built into my webcam. So as a provider, you want to say, hey, hang on just a second, I'm going to make some notes. Make your notes and come back. Now, if you have your webcam and your video going on one screen, and right next to it you've got another screen where you're typing in the medical record, or whatever, looking at x-rays, that type of thing, then it might be a little bit more seamless because you're just turning your head just a little bit, and you could still tell them. I mean, that's respectful, right? You tell someone what you're going to do before you do it. All right, so then our next slide is about external noises. I apologize. There we go. External noises. So if the patient could live in a large apartment building, there could be lots of traffic noise. The provider could be in a large apartment building with lots of traffic noise, or even at a clinical setting. If you are in a hospital and there's a loud elevator or construction going on, you want to do your best to minimize that as much as you can. There might be, in an older building, there might be HVAC noises from the cooling or heating system, those types of things. Some of the things that you can do to minimize those on your walls, you can actually paint. There is paint that will absorb sound. If you're a musician, in an orchestra or band or choir, you are familiar with sound deadening walls, basically frames with fabric hung over them to help absorb that sound. Also, ceiling tiles can sometimes absorb sound because and often in a clinical setting, there will be tile on the floor, there won't be carpet. So that can be echoey. So you need to make sure that you've got good equipment as far as your microphone and your speakers, so that you don't have a lot of echo and you have a clean conversation between you and the patient. So again, we want that clean and uncluttered view between the webcam and the patient, or the webcam and the provider. So that's pretty much all I wanted to share with you guys today. I wanted to keep it nice, short, and sweet. There are several ways other than the info@umtrc.org email to reach out to us. You can reach out to us through our website, through our LinkedIn page, and also through our Facebook page. And we also do have a YouTube channel as well. There's additional resources you can find on our website, all around about COVID-19, some telehealth frequently asked questions. We did a lot of webinars in the spring about starting telehealth programs, and we'll be doing more of those trainings as well. We encourage you to sign up for our newsletter, and we do a monthly newsletter. We also put out updates if there's breaking news about different things. Autumn has posted our survey in the chat. We do request that you take just a minute or two and fill that out. It's very simple, won't take hardly any time at all. And then Luke Wortley, if you do, email us at the info@umtrc.org or call our 800 number. He's probably the person that's going to be on the other end, and he works with Autumn and myself, and certainly feel free to reach out to us if you have any additional questions. So right now we've got about 10 minutes. I'm going to go ahead and stop sharing my slide and open things up for questions. Are any of you on the call today actually providing telehealth services? Are you clinicians?
I'm not a clinician, but I do provide technical support for people. And we've actually we have some issues with, like, we have equipment that we think might resolve the issue, but we do run into problems with echoing. Is there anything you would recommend for reducing echoing?
So is it on the provider side or the patient side?
It can be on both.
What kind of microphone are you using?
So most of our providers are provided with a Jabra microphone speaker that actually has echo canceling in it. But not all of them have that, since we had to move a lot of our in-office employees to telehealth services during COVID.
Right.
So those who are, formal telehealth clinic employees have that equipment, but we have some providers who do not have that equipment.
Yeah, Jabra is a really good system. Chat 50 is another good one. Something else to think about is gaming headsets. We recently got them for some of our staff, and they've really helped. I don't even remember which one we got now, but when you flip up the microphone on it, it mutes yourself. So it's an easy way to reduce background noise.
Is there something that we could recommend to patients if they're having echoing issues?
On the patient side, it's going to be a little bit more difficult because you don't have control over their environment. I'm trying to think. Do you know, are the patient, and there's so many variables, do you know, are the patients using smartphones, or are they using tablets or computers, or do you know?
Most of them, from what I've noticed in our analytics, we have a lot of people who are using smartphones, but we also have some people that are perhaps like using a laptop.
Yeah, maybe a headset. That's something that most people that have smart devices have some type of USB headsets or plug-in earbuds or something like that.
Okay. Yeah, I think a lot of them have started using like headphones to reduce that. I'm also usually recommending to people that are reporting echoing issues, like especially like on a laptop, to maybe lower the volume on the laptop.
Yes. Mm-hmm.
That usually seems to work.
Mm-hmm. Yeah, absolutely.
Okay, thank you.
You're very welcome. Any other questions? All right. Well, thank you all for spending some time with us today. I hope this was helpful, and have a great weekend.